ADHD is a common neurological disorder that affects the lives of a lot of people of all different ages, most commonly in school-aged children. Have you ever seen a child jumping, running around, screaming or touching everything they possibly could? Looking at that child, wondering why their parents isn't disciplining them? Can you imagine living every day feeling out of control? This is my daughter who was diagnosed with ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is one of the most common mental disorders that affects children. ADHD affects about 8.4% of children. Attention Deficit Hyperactivity Disorder is a mental health disorder that causes above normal levels of hyperactive and impulsive behaviors. There are three major types of ADHD: ADHD combined type, ADHD hyperactive impulsive type, and ADHD inattentive and distractible type. Children with ADHD may struggle with low self-esteem, troubled relationships, and poor performance in school. ADHD includes a combination of persistent problems, such as difficulty sustaining attention, hyperactivity, and impulsive behaviors. Why is this child so hyper all the time? Can this child not sit down for 2 seconds? One of the signs of ADHD is hyperactivity. The child seems to be in constant motion, running, climbing, and jumping. The child has difficulty sitting still. They tend to play with their hands, talk excessively, and has difficulty doing quiet activities and shifts from one task to another very easily. Have you ever wondered why the child isn't listening or comprehending what their parents are telling them, or having trouble in school? Another sign of ADHD is inattention. When a child shows signs of inattention, they tend to make careless errors. They have a difficult time following instructions, difficulty staying on a task, and have poor organizational skills for their age. Have you ever been interrupted by a child, and when you ask them to stop, they keep doing the same thing? When you look at the child, you would think that it's rude. Some children with ADHD often interrupts others and also tends to blurt out answers instead of waiting. Children with ADHD take more frequent risks and act before they think. You would think that treating ADHD would be simpler than what it is, but it's not. There are different factors that would be determined by your doctor, which are based on your child's age, health, extent of the child's symptoms, tolerance for specific medication, and/or therapies. There are medications and different types of therapies available to help treat ADHD. Psychostimulant medications are used for their ability to bounce chemicals in the brain that prohibits the child from maintaining attention and controlling impulses. Medications that are commonly used to treat ADHD include Adderall, Ritalin, Metadate, and many others. Psychological treatments are available for both the child and parents. Parenting a child with ADHD can be difficult and very stressful at times. There are a few non-medical treatments for ADHD, which include behavioral parenting training, classroom behavioral management strategies, and summer treatment programs that combine parent training and classroom strategies. Behavior therapies for both child and parents are recommended for younger children before trying medications, so they don't get the skill and strategies to help their child. A parent whose child has ADHD had to take different approaches when it comes to handling situations. The parents can use positive reinforcements when a child does something that they're improving on, or for good behavior. The parent can improve parent-child interactions and the way they communicate with the child. There are alternative and homeopathic approaches treating ADHD, which include special diets, plenty of sleep, meditation, and vitamins and mineral substance. First, I told you that ADHD was. Next, I told you the signs and symptoms of ADHD. Finally, I discussed some treatments for ADHD. Attention Deficit Hyperactivity Disorder has been a problem in many people's lives. Some are more severe than others and people take different approaches to overcome them. I hope that after hearing the speech, you have a better understanding and more knowledge pertaining to a child with ADHD.